Welcome to NewlyTrading.com. News on some of the newest publicly traded companies on the TSXV, OTC, and on the CSE exchanges. Newly Trading is brought to you by TheNewsWire.com, the most affordable newswire service in North America. Get started with your free trial. Today we're talking with Dr. Kyle Kingsley, CEO of Vireo Health. Their trading symbol is VREO on the CSE exchange. Good morning, Kyle.
Morning, Jim. How are you doing?
Very well, thank you. Thanks for joining us. Kyle, can you give us a little history on Vireo Health and kind of why and how the company got started and its kind of evolution to where the company is today?
Absolutely. So Vireo Health is actually one of the longest standing professional multi-state operators in the United States. We had humble beginnings in the state of Minnesota as one of only two vertically integrated manufacturers there, and this persists in our subsidiary Minnesota Medical Solutions. Very rapidly, we progressed, getting one of 5 licenses in New York, and it was sort of off to the races then, focused on these limited license states. Stepping back a little bit, Vireo Health is really capitalizing on what I see as the major opportunity in this space, and that is, remaining science and medicine focused and really driving meaningful intellectual property. All multi-state operators sort of have to do the land grab. We're participating in that. We're pretty close to as big as anybody, but I feel like the bulk of the industry is missing the real opportunity here, which is seizing the IP. And, I'm not a banker telling you that we're the best at science. I'm a physician with a team of physicians and scientists saying that. So we have a fundamentally different DNA, a fundamentally different approach to this space than most multi-state operators. The biggest kind of fundamental tool that I bring to Vireo Health is the fact that I practiced emergency medicine for over a decade, and it's a surprising preparation for the cannabis space. You really learn to know what to do when you don't know what to do, and you really also embrace sort of the chaos of the space. So that's sort of it in a nutshell. We have been able to build a company with this significant science focus. We have 4 full-time physicians, a slew of kind of crack scientists that are working on very meaningful intellectual property development. Interestingly, our chief science officer is a pharmacologist and an IP lawyer, a guy named Eric Greenbaum. He drives a lot of disproportionate opportunities for Vireo Health.
Your interest in medical marijuana and the cannabis space was influenced through your experience as an ER doc. Can you tell us about that journey?
It was pretty neutral, but I certainly didn't appreciate that cannabis was medicine or had those capabilities. As an ER doc, I was in the front lines of the opioid space, and so I had this very acute awareness of this catastrophe, this public health crisis that opioids represent. I saw addiction, I saw overdoses, drug-seeking behavior, all because of this class of opioids. And I didn't really see cannabis as an alternative because my education didn't lead me there. But I saw a few patients in a short period of time, and I saw a patient a few nights in a row. A gentleman was shot in the back during one of the Gulf Wars and had just horrible muscle spasm and pain in his legs. And as a ER physician, you develop a very good sense for kind of when people are being completely truthful, and this guy was very compelling. He just was a straight shooter. He refused to smoke cannabis in in Minnesota because it was illegal. Got to talking with him about 3 a.m. one morning, and he said, "Doc, when I was in California, I would just smoke cannabis. I was on no opioids, and I had almost no pain." And again, he refused to smoke in Minnesota because it was illegal. I asked him, why don't you just go back to cannabis? And so that was very compelling. I saw 2 similar patients in short order, and I decided that I would just check out the industry at large. I went to Colorado, California, saw a lot of good folks doing a lot of good things, but I didn't see a lot of, expert kind of business and scientific practices. And that was, I saw an opportunity there. Minnesota came up with this very medically focused law, which, in hindsight is a little bit too restrictive. But if it hadn't been restrictive and medically focused, I don't know that I would have ever made the transition from, ER doc / startup guy to the cannabis space. I can tell you this is what I was meant to do, and I can't imagine doing anything else. I have the best team in the space. Not only that, but we have the best and most unique direction with this heavy focus on science. And just one other thing, tend to get pigeonholed as, a medical marijuana company, but science, superior science drives opportunity across the spectrum from, medical into health and wellness, which I think is going to be a very significant space in the future in a mature market, and also pure adult use. Everybody wants precision. Everybody wants quality. Our science and medical inputs can drive superior opportunities across the spectrum of cannabis regulatory setups.
So what's next for the company?
Yeah, similar to other MSOs, we're acquiring geographic footprint. We just recently closed this week here on Arizona and New Mexico, very meaningful acquisitions with great partners and operators there. We take a fundamentally different approach in that we are miserly is extreme, cheap that has kind of a negative connotation. We're amazing stewards of resources. I'm a startup guy. I'm used to starting up businesses for hundreds of dollars, not millions. And so we've really scoured the United States for cost-effective opportunities that not only are affordable up front, but have the opportunity to grow. So that's sort of the acquisition strategy. If you compare our acquisitions and price point with our competitors, there's really no comparison. So very proud of being a great steward of resources. Next, we are uniquely positioned in merit-based license processes. So you look at states that are a little more conservative. Basically any state that doesn't have a medical marijuana program right now is obviously going to be on the more conservative end of the spectrum. And who do you think they're going to look to, or who are they going to prefer as far as one of their limited number of merit-based licensees? I think that it's going to be a physician and science-heavy Vireo Health that's uniquely positioned there. We're very interested in places like Georgia, places like Missouri, places like South Carolina, Utah, that will limit the number of licenses, have a medical focus, and a very rigorous, selective, merit-based selection process.
Well, Kyle, thank you for taking the time to give us some background on Vireo. Congratulations on your listing and as you're moving forward, and we'll certainly keep an eye on the company. All the best to you in the future.
Jim, thank you so much.
That was Dr. Kyle Kingsley, CEO of Vireo Health, their trading symbol VREO on the CSE exchange. That's it for this episode of NewlyTrading.com, the podcast. News on some of the newest publicly traded companies on the TSXV, OTC, and on the CSE exchanges. Newly Trading is brought to you by TheNewsWire.com, the most affordable newswire service in North America. Get started with your free trial. NewlyTrading.com and this podcast are solely intended for information purposes. If you're considering investing in securities, always consult a professional advisor. I'm Jim Ripley.